Lumbar epidural steroid injections, or LESIs, are among the most common procedures performed to manage lower back pain caused by conditions like spinal stenosis, herniated discs, and degenerative disc disease. Each year, millions of these injections are administered in the United States, aiming to reduce inflammation and relieve nerve root pain. LESIs can be performed using two main techniques, the interlaminar and transforaminal approaches. Both methods deliver corticosteroids directly into the epidural space, but they target different anatomical areas and carry unique risks. While LESIs often help patients avoid or delay surgery, it's important to recognize that, like any medical procedure, they are not without potential complications. In this video, we'll explore the incidence of these complications, the most common types, and the key patient factors that increase risk, helping you better understand the safety profile of LESIs. Let's look at the numbers. In a large study of over 720,000 LESI procedures, the overall complication rate was found to be 2.5% within 7 days and 8.8% within 30 days after the injection. Complications are divided into procedural and medical categories. Procedural complications, such as neurological injury, epidural hematoma, and infection, were relatively rare. Neurological injury was the most common, but still occurred in less than 1% of cases. Medical complications, including heart rhythm disturbances and urinary tract infections, were more frequent, with dysrhythmias and UTIs leading the list. Emergency department visits and hospital readmissions also occurred, though at low rates. Interestingly, the interlaminar approach was linked to a slightly higher rate of early complications, while the transforaminal approach showed a higher risk for certain late complications. These findings highlight the importance of monitoring patients not just immediately after the procedure, but for several weeks afterward. Not all patients face the same level of risk after a lumbar epidural steroid injection. The study identified several key factors that increase the odds of complications. Advanced age is a major risk. Patients over 85 had significantly higher complication rates than younger adults. Other important risk factors include having heart failure, renal dysfunction, neurological disorders, and psychiatric condition. Use of anticoagulant or antiplatelet medications also greatly increases the risk, especially for bleeding-related complications. Female patients and those with certain comorbidities such as hypertension, diabetes, and obesity were also more likely to experience adverse events. These findings underscore the need for individualized risk assessment before proceeding with LESI, as well as careful post-procedure monitoring for those at higher risk. By understanding these risk factors, clinicians can make more informed decisions and help minimize the chances of serious complications. But what does all this mean for patients and healthcare providers? The key takeaway is that while lumbar epidural steroid injections are generally safe, they are not risk-free. Complications, though uncommon, can be serious and may occur up to a month after the procedure. The choice of injection technique, patient age, underlying health conditions, and medication use all play a role in determining risk. Clinicians, this means that a thorough pre-procedure evaluation is essential, including reviewing comorbidities and current medications. For patients, it's important to discuss your full medical history and any concerns with your provider before undergoing LESI. Ultimately, understanding the nuanced relationship between technique, patient factors, and complication risk can help ensure safer, more effective management of lumbar spine condition.